Staphylococcal Scalded Skin Syndrome, SSSS, is a severe exfoliative dermatitis primarily caused by toxin-producing strains of Staphylococcus aureus. It predominantly affects infants and children under 6 years old. SSSS begins with localized skin infections that release exfoliative toxins into the bloodstream, leading to widespread skin redness, blistering, and peeling. Symptoms often include fever, irritability, and painful red areas, with blisters that can rupture easily, leaving tender skin behind. Diagnosis typically involves clinical evaluation and may include skin biopsies or cultures from suspected infection sites. Treatment is often intensive, requiring hospitalization for intravenous fluids, antibiotics, and supportive care similar to burn management. Complications such as dehydration, secondary infections, and sepsis can arise, particularly in untreated cases.